I'm Judy Griffin with Aroma Health Texas. Today we're going to look at some high linalool essential oils for cancer care. And not all of them, but some of them especially are very good for helping to stop cancer cells from multiplying, and which causes tumors, so it reduces tumors, it reduces metastasis, which it causes cancers to spread, and it raises oxidative stress in cancer cells because it programs their cell death. Now, Linalool can do this with very little side effects, which is great compared to chemotherapy. Sometimes people have irritation or allergy. There's always one. But otherwise, this is a monoterpene alcohol, so it means it's very soothing. And the scent is kind of floral, slightly spicy sometimes, but the soothing part of this chemistry of linalool is what makes it especially good for so many different types of cancer, such as prostate, colon cancer, colorectal cancer, leukemias, cervical cancers especially. Linalool is especially prevalent in rose, damask rose, the damascena rose, which I haven't talked about rose really before, but I use rose in every type of cancer care, as well as with most every other illness that I worked with hospitals in patient care. And of course, there's sweet basil. And sweet basil I want to speak to you about because it's a good example of something I want to prove to you. Sweet basil is very high in linalool, so it's an excellent essential oil for cancer care. If you get most of the other basils that aren't sweet, or you get a mixture of it and you don't know it when you buy it, then it can be high in estradiol, and that is something that can be very harmful to cancer patients. So know your source when you're getting your essential oils. Sweet basil is only that variety and none other variety with it. Coriander seeds are high in linalool, and they have to be distilled. Sweet orange and clary sage, which we mentioned before, and jasmine. Rosewood is a good essential oil for linalool. It's Aniva rosadora, and it's 80% linalool from the heartwood, the inner wood of the rosewood plant, and that's a tree that grows in South America. It's not really endangered anymore, but it's one that is being carefully watched that we don't over-harvest it in our quest to get essential oils and be healthier with them. Rose also promotes tissue regeneration, which is one reason I use it in so many blends in cancer care. But many people like the scent of rose. Again, you don't have to use an overwhelming amount of rose to get the scent across or the feeling across when people smell or apply a little bit of some of our essential oil blends, like the Harmony blend. And especially works well on prostate cancer and colorectal cancer. And the prostate cancer men that I've worked with, they love the smell. It's like, can you put some more rose in there? You know, it's like, okay, it's kind of cost a lot to make, and when you're distilling or utilizing any of your old roses, these are the damascena, the damask roses that we're talking about today, you want to be sure and harvest them not real early in the morning, but usually before noon. And then you want to get the buds that are opening, but not wide open for your most medicinal effect. When it's wide open, it's easy to get your nose in there, but the rose itself doesn't have the highest frequency and medicinal effect that you will get if you get slightly opening roses. Rose especially is good for radiation because it works with tissue regeneration, and a lot of prostate cancer patients have that. Many breast cancer patients have this at some point in their therapy. So it can be very helpful. You always have to ask if you can put the blend on or where you can put the blend on. I'll just remind you that in hospitals I had them smell it if they really like that. And then we just put a little drop right and rub it into their ear. You don't want it to go in the ear hole, but that way it will not interfere with any radiation, any chemotherapy especially. And for radiation, sometimes the doctors allow the rose blends to be worn close to where they're radiating. You really need to find that out. It may vary with doctor to doctor. I hope you find us on aromahealthtexas.com, where you can find these essential oils and many other products that we organically grow and distill and make locally for you. And we'll see you next week. Please like and share, and let me have your questions. Bye-bye.